Welcome to the Medical Fitness Podcast. I'm David Flench, President and CEO of the Medical Fitness Association. As always, I'm joined by a co-host. Today, it's Thomas Hammett, Director of Clinical Services at Pinnacle Physical Therapy and Medical Wellness. Today, we're thrilled to welcome Dr. Lucius Pomerantz, a renowned orthopedic surgeon who is also board certified in lifestyle medicine. Dr. Pomerantz is also a founding member of the newly formed MFA Physician Advisory Committee and a passionate advocate for integrating fitness into healthcare. We're excited to dive into today's conversation on the intersection of fitness, medicine, and lifestyle medicine specifically. Thomas, it's great to see you. How are you today?
Yeah, David, great to see you too. And I'll just add during this intro, it's great to have you here, Dr. Pomerantz. Your expertise in both orthopedic surgery and lifestyle medicine positions you perfectly to help us explore how we can improve the health of our communities. We're looking forward to your insights on how fitness and medicine are working together to reshape patient care. And I'll just say on a personal level, I'm excited to have an orthopedic surgeon, a guy focused on the upper extremity here to talk with us. I think there's a lot of really fun stuff that we can get into that will just be great for our listeners. So thanks for joining us.
It's an honor to be here. Thank you for having me.
Yeah, again, Dr. Pomerantz, thank you for joining us. To start things off, can you maybe tell us and our listeners why you originally got into medicine? And then as you've progressed in your career, I'm interested to know, have your reasons for staying in medicine stayed the same or have they evolved over the years?
Yeah, the whole process of going into medicine and where I'm at now, 10 years into practice, has been a constant evolution, we'll say. I wasn't one of those kids who had a plan. I guess being a doctor was an idea. My parents were great parents. They always were supportive of me and maybe instilled an altruistic sense and that kind of thing. My dad was a firefighter. My mom worked in city politics, but there's no pressure to be any certain thing. But I had an aptitude towards reading and learning. I was always very much into sports, but I was a late bloomer, we'll say, and so I had some physical disadvantages. And I tried to figure out some ways to level the playing field. So I was in the library learning about sports nutrition and even sports psychology, trying to figure things out just to give myself a little bit of an edge so I'd be a little bit better at sports. And it's probably a combination of all these things that opened the door to medicine being an option. And it was well into college that I pulled the trigger and went for it. And then it was well into medical school that I decided I was going to be an orthopedic surgeon. It wasn't originally the plan. I didn't think I was going to be a surgeon, but the idea of being able to use my hands to get some immediate feedback in a way on helping patients was appealing, especially orthopedic surgery. It has the ability to take that person with a broken hip who can't walk and they're walking the next day. And being able to restore mobility and the things that they love to do was big. That was kind of the biggest motivation of going into orthopedic surgery, is getting people back doing the things they want to be doing, or at least maintaining their ability to do the things they want to do. And then the special attachment to hands, which became a further specialty, just the realization of our hands being how we interact with the world. And it could be gardening, it could be surgery, it could be punching somebody, but our hands are the way we do it. And so to specialize in that, I found that much more gratifying. And as we've gone forward, and I'm now 10 years into practice, I've kind of, in a way, come full circle and realized that while I still love orthopedic surgery and that relative immediate gratification of helping people, there was a greater picture that I was not addressing with a lot of my patients. A lot of other things that factor into patient outcomes and their well-being beyond what I could provide as a hand surgeon and orthopedic surgeon. And so this past year, I found out about lifestyle medicine and dove in and got the board certification, and it's helped me round things out a little bit more.
I love that that segue was you at some point came across the idea that there was a bigger picture. And it sounds like maybe you've always known this a little bit, but that at some point it became important to you, important enough that you invest in ongoing certification of some kind, right? Is there
Yeah.
like what was that over time? Was it, seeing people that could benefit from more? Is there like a specific story that led you down that road? Like maybe tell us a little bit more about that.
Yeah, I mean, so classically, orthopedic surgeons, we just care about, the bones and the muscles and the joints, and that to a point is true, but we all know that there's a lot of other factors going into how patients live their lives, and it influences the outcomes of their surgery and why they're even seeing you in the first place. And some surgeons, some people decide, what, I'm just going to deal with my little niche and be happy with that. But for me, it was kind of, I would be asked about nutrition stuff. What can they do to, reduce inflammation or recover from their fracture quicker, or other ways of feeling better. And I knew stuff, and I wanted to share it, and it just kind of kept growing and building. I guess there wasn't a specific patient or specific story, but it was kind of the accumulation of situations where it's like, there's more I can offer, even within the short periods of time that we have to see patients um, that could help a patient maybe avoid surgery or at least recover faster from their surgery.
Yeah, if it's okay, you and I didn't get a ton of time to do an intro before the call started, but I'd love to tell just like a quick story, if that's okay, about the company I
Yeah,
work for, because I think, one, I think it'd be really fun to work with you as a surgeon referral source, because it reinforces a lot of the identity of, uh, all the things that you're saying reinforce the identity of why we chose to go down a specific road that we did. So the company I work for started as a private practice PT group and was seeing a lot of the same things that you are, right? Like these patients that come in with acute injuries um, tend to come back with the same acute injuries, or maybe have a surgery down the road for that acute injury, and it doesn't ever go away. And we love our patients coming back to us, but when it's coming back to us over and over again with pain, we know that that doesn't mean that they're, ultimately satisfied with their health and back to where they want to be. And so we started to look for that big picture too, right? Of like, what's behind all this. And part of our story was working with a surgical group, much like yours, to help support like these patients that are thinking about getting surgery, a rotator cuff repair or a total knee replacement. Um, we need them to be in good physical condition to go through surgery and have a good outcome, right? So is there anything we
totally.
can do to optimize their surgery? And that's where like the physical therapy and exercise side came in. We ultimately found that there was a group of people that's going through a lifestyle optimization program, ended up not getting surgery, because the physical activity and nutrition changes they made were the kind of thing that like really did it helped support their pain and their mobility enough that they felt like, okay, maybe I don't have to do that. So I just love your story. I really appreciate you sharing it. And again, I think you'd be a fun person to work with. I'm
Yeah.
curious if you, and this is kind of off our beaten path here a little bit, but do you work with other people down the line in medicine that kind of support you guys from a lifestyle optimization standpoint, or like what does that look like for you? Are you doing a lot of the counseling, or are there other people that support you?
We're starting to grow a network of sorts. We've always had physical therapists part of our group, and understanding what they do with their jobs is also important. Communication and knowing what they can do, and them understanding what we're doing, all helps. We recently hired a nutritionist, which has also been helpful. Hopefully, our group can better utilize and grow her ability to help patients within the group. But there's so much more that we can add in, and hopefully over time we'll do it. But at least for now, I can, with more confidence, kind of approach the bigger picture with the goals of what I can do as an orthopedic surgeon. And it sounds like what you have going on is great. I'm so glad that those things exist.
Yeah, man. I think, it's funny is one of the first things we did too is adding nutrition services. And I think because it feels like such a good plug and play. And what I'm going to do right now, I told you I was going to do this, but I watched some videos on your YouTube channel. It's a great YouTube channel, by the way, for the listener. It's called Cut to the Bone. And you have this really great video on, it was like tissue healing or wound healing 101. Which sounds funny, like to think about talking about wound healing and physical therapy. A lot of the time, we're dealing with things that aren't necessarily superficial, like a cut or that kind of thing. Though we do help people with, their post-op care, and that includes the wound from that. But what you talk about is so relevant in terms of just how the body heals itself. And the end of the video goes into the lifestyle factors like smoking, like nutrition. The first bullet point you bring up is nutrition, and I just thought that was so good. So for any listeners interested in kind of hearing the lifestyle component of this applied to surgery, applied to how the body heals, I thought that was a really helpful video and a good way to make the lifestyle component relevant. Because, you're talking about of adding a nutritionist or dietitian into the clinic. In theory, it works, but you have to make it feel really important and relevant to the patient. And anyways, I think it's cool that you're going down that road. It's very similar to what we did too. And I think it's great. So thanks for sharing what you're doing with that.
Oh yeah, no, and thank you for watching the YouTube channel, and hopefully a few other people can get benefit of it. And we all within medicine, we all know like, hey, smoking's not good for you, and you should eat right. And but as we kind of delve into it a little bit more, one, sometimes it gets blurry. I mean, the world of nutrition and diet gets complicated, we'll say, and people at very far extremes feel very strongly. And it's interesting how that debate goes, but I think there can be certainly some consensus on what a healthier looking diet looks like. For example, just eliminating the processed foods and reducing sugars and things like that. That won't get into the meat and all that kind of stuff, but yes, eating healthier. We all know, not smoking. Yeah. And then, yeah, you should get exercise and you should sleep and you should have good connections with friends and all these things we all kind of know. And the way our medical system got set up is, as an orthopedic hand surgeon, I'm not going to be expected to talk with my patients about those things. And, the cardiologist might talk a little bit about diet and things like that, but they might neglect the social connections and vice versa. There's all these things. So it just gets very compartmentalized along the way. But I think hopefully taking a step back and really reiterating with patients that there's all these factors that they have control over, that they can achieve through changes in their own lifestyle. And it's not necessarily easy, but it can be done and it's in their power. I think that autonomy to a patient can also, if they figure it out, be really empowering for them. So, yeah.
Yeah. I think even what you said too about, a lot of the time, the choices that are given to people or that feel like the choices that you have to make when it comes to lifestyle change feel extreme. And the benefit to, to having, a support person like a nutritionist is that it doesn't have to be extreme. It doesn't have to be, go full whatever diet is the new diet people are doing now, right? A small change can make a big difference and is often the right first step, right? That's kind of the going down the big change continuum. So
totally small changes, incremental steps, things that can be sustained. Crash diets or cutting things cold turkey, sometimes it's the right thing to do, but more often than not, it's just iterative steps in the right direction, knowing there might be a setback or, a step backwards at one point, but you just keep trying to improve and it's all within us one way or another.
Yeah. I have one more question down this road, and David, we'll just make this be the question that I was meant to ask, but on the physical therapy side, we get a lot of patients when we introduce the idea that there might be a bigger picture to what's going on, or an optimization of lifestyle component that's possible. The response sometimes initially is like, yeah, but I came here because my shoulder hurts and that's what I came to fix you for, or I came to you to fix. And that's on the physical therapy side. They're already expecting us to talk about exercise with them. You guys are like the orthopedic surgeon world. It's very much, I think, viewed from the outside as, the cut and the work that you do is gonna fix the problem. Do you run into this, and kind of how do you deal with that conception, or whatever that word is that I'm looking for? How do you deal with that perception that people may have?
That there's just a single problem, their shoulder being the thing that and not a larger picture. Yeah, it's hard. And certainly as surgeons, we immediately are going to be dividing things in our head, surgical versus non-surgical. And all of a sudden, we're even compartmentalizing things even further. What I am finding is beneficial is, and this is the whole thing of finding meaning, finding purpose, finding things like that. And a lot of, psychology, even psychiatry, was about subtracting bad things. Someone's depressed, someone's anxious, and so you're trying to eliminate those negative feelings. But there's this trend now of positive psychology, trying to permeate positive feelings and grow on the positives. And within orthopedic surgery, okay, pain is a thing. It's not fun. That's why you're here. But let's find this bigger purpose. Why do you want the pain to go away? Hopefully you want more function, even if it's just sleeping better, which is important. But maybe it's because you want to throw your grandkids in the air. Maybe it's because you want to get back to playing basketball, whatever it might be. But on our end, as the doctor, as the care provider, finding that deeper meaning beyond subtracting pain or, whatever it may be, to give it an outlet, something for them also to aim for, I think is helpful, and kind of gives the bigger picture and introduces other things along with nutrition and sleep and stress reduction and all that kind of stuff.
Yeah, it's so important to reframe from like the mechanical issue of a shoulder hurts back to, and it's just having good customer service in medicine, and being a good provider and a good person is understanding what someone wants out of the outcome of that and how to best support them to that place. Certainly having a more positive language and mindset it certainly helps, right?
Totally.
I think if there's one more thing that I'd share on this too, from my perspective, that's helped has been, I think a lot of people don't understand the connection between the bigger picture of health and those orthopedic issues. That carpal tunnel syndrome is much more likely to occur in people that have diabetes than don't. And recovery from any surgery pretty much is better if we control blood sugar for people that do have diabetes, on and on, right? But I think people just don't understand those connections. And when the connection's made clear, and then managing the condition is also made clear, that, it'll help you improve and have the outcome that you're seeking and support the lifestyle that you want, as all the things you were mentioning. I think it just gives people the idea of okay, these extra tools are important. It's not just he's not just saying it because this is what a doctor's supposed to say. It's there's actually tangible reasons to support my healing and condition.
Totally. Yes. I mean, it's all a picture. Our bodies, even our joints, we part of my discussion with patients is that a joint isn't just this hinge that moves. It's an organ. I mean, there's all these other cells and tissues working together for it to work correctly. And systemic inflammation is going to affect your joints. It will affect your heart. It's going to affect your kidneys, but it's also affecting your joints. And so eating a good diet and controlling your sugars and quitting smoking and maybe not drinking so much, all these things factor into it. And it's also important to really kind of impress upon my other orthopedic surgery colleagues that, we know, hey, that patient you're going to do that total hip on, who's essentially malnourished because she's just been eating toast and having tea in the morning and doesn't really eat anything else. And that her labs show that she's got low protein and albumin, and she's not going to heal so well. Maybe give it a little more time, really get her plugged in with that nutritionist to come up with a plan, make sure she's getting the protein she needs, making sure there's going to be those easy access to the good nutrients that are in the household, are going to improve what we care about as orthopedic surgeons, that good outcome.
I love where this conversation's going. We're getting into how, holistic health and solutions towards that can really improve, whole health. That's, kind of a buzzword now. But it really encompasses a lot of what we advocate for at Medical Fitness Association. I mean, going back to when I ran medical fitness centers, same thing. If somebody wanted to lose weight, but they had musculoskeletal issues and pain and things like that, they were going to have a much harder time achieving that other goal. They didn't take care of this. So it's all kind of, wrapped together as we're talking about. Um, the other thing that I liked, you said, finding purpose and finding meaning. And that kind of leads me into what I wanted to ask you about. For those listeners who aren't also watching, in the background for Dr. Pomerantz, I can see a framed picture of some sort of mixed martial arts, I think. And, you've shared how you're into Brazilian jiu-jitsu and mixed martial arts. So I'm interested, and even one of the things you said that I don't know if people caught on to, but I'm pretty sure when you said, if it allows you to punch, that probably was an alluding to martial arts. But is there a link between your interest in these sports and martial arts and with your career as a surgeon, and maybe then just how that passion impacts your approach to patient care?
Yeah. So yes, in junior high and high school, I was a wrestler. I had to find something with weight classes just because I was so small. And then that led to Brazilian Jiu-Jitsu, which is like wrestling, but instead of trying to pin your opponent, you're trying to put them in a submission hold where you're locking a joint or you're choking them and they have to tap out. And in the early 2000s, the world of Brazilian Jiu-Jitsu and the world of mixed martial arts were very much linked. And so I fought a couple times in a cage. I did a couple MMA fights. And all of it was kind of an adventure. All of it was kind of to see if I had it in me, because I'm not a particularly aggressive person, and I don't think I was ever in a real street fight growing up. But I wanted to know if it was inside me to test my will against someone else in a cage. And so in medical school, I did my first fight, and in my residency, I was able to put together another fight. And what martial arts has provided, it's been a few things. One, it was kind of a counterbalance to the world of studying and medicine and the slog of just being in a library for hours. I had the counterbalance of getting some aggression out, getting some exercise, doing something completely different. Kind of refreshed me and made it easier to go back to studying once I got a workout in. And then things like martial arts and jiu-jitsu and MMA, it just with the difficulty and the stakes involved, at least for me, it gave me some purpose in, hey, you know what? While I could go out and have some drinks, I'm going to feel like crap tomorrow and it's going to mess with my training. So maybe I'm not going to do that. And you know what? I notice how when I'm training and I'm trying to get in shape for a competition coming up, I notice if I've got 5 extra pounds on my legs. So I want to keep my weight down and I'm going to eat a little bit healthier. And, certainly I'm not going to be perfect along the way. And there's times, yeah, sure, I'm going to indulge a little bit, but having this purpose where there's some stakes, if I'm not being my best self, has kind of given me direction throughout my whole life. So direction and a counterbalance to the medicine side has what jiu-jitsu and MMA has provided me.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association, helping fitness professionals and medically integrated fitness centers achieve their full potential through education, certification, and networking opportunities. Join today and elevate your career with the Medical Fitness Association. Visit medicalfitness.org to learn about the many benefits of membership offered by the Medical Fitness Association. That's medicalfitness.org.
Do you think that translates into how you treat your patients?
It's impossible for it to not influence it a little bit. Certainly, I have a bond with someone who's in a combat sport, whether it's boxing or jujitsu or whatever it might be. There's kind of a simpatico understanding of kind of, I'm never going to tell them, hey, you can't do that anymore. I know that's not an option. And as a person who's had to work around my own injuries, I have some suggestions, and they really appreciate that. So that's definitely helped me interact with some of these combat sports athletes better. But the little old lady who's not into combat sports, who just wants to get back to gardening, I can still understand the desire of wanting to do something that they want to do, that is even a pursuit of mastery. To get really good at gardening takes skill and effort and constant work, just as I had to do with my martial arts. They're doing it with something different, but I can kind of tap into what that feeling is and best try to figure out what's going to work for them.
Yeah, I think that pursuit of mastery and the purpose conversation is such an important foundation for even just thinking about lifestyle change in general, like supporting people in thinking about like, why would, I've got to optimize my nutrition. Do I really want to do that? It feels like work. And when you attach it to a purpose like that or a bigger goal, for you, if it's mixed martial arts, or for, the person you were just talking about and it's gardening, you get to be the best version of yourself when you feel good doing it and feel healthy doing it. And it gives you that incentive to do the things that are best for your body and your health. And yeah, it's important. And one of the areas we haven't talked a lot about in this conversation, I think this happens in lifestyle medicine a little bit. It's funny. I actually think at times in lifestyle medicine, physical activity and exercise is like the forgotten pillar. Not totally forgotten, but maybe not recognized at the level that I think it could be. And we haven't gotten into that a ton yet. And I'm curious, even just what your perspective is, like if you're coaching your patients or talking to your patients about exercise and physical activity, where do you start? What do you talk about? And yeah, maybe let's just start there.
Yeah. So yes, exercise is unfortunately forgotten. And mainly it's just, again, people know that they should exercise more, but they don't know what that necessarily means. And certainly it's going to be different for every person. And it's also kind of, it falls down on the rung of priorities. You got a family, you got a job, you got to sleep, you got to do all these things. And so now all of a sudden, you don't have time to exercise, or at least you don't understand that you don't have to spend 2 hours in the gym every day for it to count as exercise. So often it's figuring out the patient's priorities, what their obstacles might be to getting exercise. And I know how it is to not have time to I haven't put it together a 2 hour workout in a long time because I don't have that time. But I'm really good at doing something for 20 minutes, 30 minutes, stringing together. Maybe I'll go for a walk while I'm on a phone call. There's ways of stacking things or finding short periods of time to do the exercises you want to do. And if it's someone who doesn't exercise at all, well, we're going to start with modest goals. And maybe it is just walking a mile and doing it 3 times a week. And then you build on it and you grow from there. And hopefully, as you fight through the battles and you figure out how to fit it into your life one way or another, then it becomes easier. And then you can go for longer. And then maybe it turns into a little jog. Or maybe you realize, you know what? I like to swim more. Okay, great. You build on it and you adapt and you figure out what the patient likes most. But it is a struggle, no doubt, to figure out the times and the places and how to best exercise. And I guess the general rule, what patients are, what's going to be best for me, the thing that you like to do, the thing that you're going to keep doing is the best exercise. So.
Yeah, I love that concept. There's something that goes right along with that. I'll give credit to Dr. Andrew Mock, who's on our board. But one of his concepts is no 0 days. So if you get to the end of the day and you haven't done any, real exercise, you just do something for a couple of minutes. Do 20 squats. Let it take 2 minutes, and then you have something that day. So it doesn't always have to be the 2-hour workout. It probably won't usually be that. Like you said, people are busy, but we know that there's plenty of research that talks about just getting some exercise on a regular basis. And like you said, something that you like to do and can sustain has tremendous health benefits. So if we can, counsel people
Totally.
that way, and not set the expectation too high, that's too overwhelming, that makes a huge difference. So I love that you're thinking that way as well.
Yeah. Yes, just a few squats is better. Air squats is better than nothing. And so just a little thing, and you build momentum, you get little wins, you're keeping track of, hey, I couldn't do 10 air squats last week, but now I can. So that's a little win. And next week I'm going to try to get to 15. Instead of taking the elevator, take the stairs. Little things to build on and keep growing and get some sort of exercise is so huge. And the health benefits, it's clear. The research is there. Just about every facet of our health is affected by the ability to exercise, whether it's our joints or our heart or our lungs or our skeletal system. It's all benefited by exercise one way or another. And so it's probably the most important medicine that we can choose to do just about any place.
Yeah, I think it's, I can tell that you're someone who's actually trying to have these and having these conversations with real people, because the first answer you came up with was that time is a barrier, right? And the barriers that people present to us with is the first thing. It's either cost or time. And I work with someone I respect quite a bit that says that, your willingness to invest time and energy in something is a function of your priority towards those things. And, I think the reason that doing that exercise you enjoy resonates so much is because it engages you in using your physical body to do something you love. And that is often it's the gateway drug to doing more exercise, like doing the cardiovascular exercise that keeps you in shape to do that thing that you love. And if there's anything we can do to help people fall in love with something they do that's active, that's the best first step, right? To helping people prioritize exercise that reinforces those things they love. So I can tell you're someone who's doing this. Obviously we get the time barrier, obviously we get the expense barrier. I can't drive to a gym and pay a membership that so on and so forth. But people who really start engaging with their bodies and do things they love that way will find the time, they'll find the energy, and sometimes even find the expenses to invest in.
Yeah. There's always barriers. There's always things that make it harder to do. And I guess, the whole lifestyle medicine. And what was interesting for me was it's a big change in how I address someone's problems. I can write a prescription and go, hey, exercise 3 times a week, but it's not going to work that way. You kind of have to be a coach, and you figure out their priorities, you figure out what their barriers are, because everyone's going to be a little different. And then you come up with a plan, and then you have to adjust and see where they're going and what might work better and what hasn't worked. And so it's just this constant evolution that you're going to be shifting and changing with the patient to figure out what's going to be best. And time and cost do not have to be barriers, for sure.
So switching gears just a little bit, Lucius, you joined as one of the founding members of our newly formed MFA Physician Advisory Committee, which I'm just really excited about getting off the ground. And we had our initial meeting, and there's a lot of physicians out there who are like-minded with the lifestyle medicine approach. And we've at MFA tried to align very closely with the American College of Lifestyle Medicine. There's so much overlap in what we believe. And while we know it's still the early days for the MFA Physician Advisory Committee, I was interested to know if you have any specific goals for your role on that committee, and how you see maybe the committee's work impacting both the healthcare and fitness industries moving forward.
Yeah, first, I'm excited to be part of this and to help grow something that hasn't existed yet. While unfortunate that it hasn't existed before, I'm so stoked that people like you all are making it happen now. Better late than never. Um, Man, there's so many directions that this type of thing can go, and there's so many things to tackle. And fortunately, there's this growing awareness, both in the general public and with physicians, of how fitness and lifestyle is going to improve the overall health of people. I guess coming at it from my angle of orthopedic surgery and the carpenters of the human body, if you will, I would like to hopefully kind of be the spokesperson or representative to that world of orthopedic surgery, to one, encourage the orthopedic surgeons to be more aware of lifestyle and the other things that go into to overall patient health, and encourage them to push those things forward, at least discuss, open the conversation with patients, and then also to be an interface with patients who are looking to make the lifestyle modifications, but might end up needing some sort of orthopedic care because things have gotten to a point, or they've tried everything else. And now, sometimes there are limitations to what can be done. And orthopedic surgeons I mean, it's pretty amazing what people can do to restore function and get people back to the life they want.
Yeah, I think even I appreciate your perspective on that. And I think it's really tied to the next question I have that may be a little repetitive, but I want to ask it anyways, because I think it is just a little bit different. Looking to the future, where do you see medical fitness in general, like the industry headed, and what opportunities do you think exist for the integration of lifestyle medicine and medical fitness to reshape not just the health of individuals, but also our overall health landscape as a population and communities?
Yeah, I hope to see fitness becoming a fundamental part of our society, one way or another. And they talk about Tai Chi being the national form of exercise in China, which is 1.5 billion people or whatever it might be. To have a national form of exercise for the United States, whatever that might look like, that would be so cool to have this, at least an acknowledgement that every person should have this baseline fitness and thing to work towards and do. And with the current politics of things, however it may go, I think there's at least now an awareness that lifestyle is important, and hopefully that pushes it on, one, the physicians who will find time to discuss those lifestyle things, whatever it may be, but then also for the patients to take responsibility for the things they need to do. It's not just a pill, or it's not just going under the knife. It's things they have to work at to make the changes they need to make. So those are the two directions that I hope to see come in the near future.
Yeah, that's great. Kind of a call to action, both to the medical community, but also to the population at large, right? There's stuff that we can do. We know that lifestyle and health are impacting this picture. There's stuff we can do about it. So I appreciate that. Thanks.
Yeah, there's definitely things that can be done. And shifting some of the responsibility back onto the patient to take responsibility for their health it's crucial. And I think through education and lowering barriers and helping patients understand what it might look like can be huge for them to take that responsibility.
Well, Dr. Pomerantz, I think it's about time for us to wrap up here. Thanks so much for sharing your insights with us today. I've really enjoyed learning about your journey, your approach to medicine, certainly your vision for the future of medical fitness. I loved learning a little bit through your YouTube channel, just chatting with you about the upper extremity. I think you and I could have a really good long conversation in the future just about even the language we use in talking with our patients to help them get their heads around the importance of change and making other members of the medical team relevant. So that was really fun. I appreciate chatting with you today.
Yeah, it's been great. Thank you for having me, and having this whole process going on, I think is a great step forward in improving overall health for everyone. So yeah, thanks for having me.
Absolutely. Yeah, thank you on behalf of Medical Fitness Association as well, Dr. Pomerantz. We really appreciate the work you're doing, especially with the new Physician Advisory Committee. I really look forward to seeing how we can continue to drive positive change in both healthcare and fitness. And knowing that you're in Southern Cal, the MFA annual conference is out in San Diego this November. So I think you've told me that you're going to be there. So I look forward to interacting with you and our membership having the opportunity to learn from you and talk with you. We have a lot of really cool things happening there. So thanks again for being on the podcast. Thank you all, our listeners, for tuning in to the episode today for the Medical Fitness Podcast. Be sure to subscribe so you don't miss any future discussions with experts like Dr. Pomerantz. Dr. Pomerantz, for anyone who would like to get in touch or learn more about your work, what is the best way for them to reach out?
Sure. My physical practice is here in San Diego through the Synergy Orthopedic Specialist Group. I have strayed into the world of social media. Instagram, I guess I pay the most attention to, and that's Dr. Luke MD, DRLUC MD. And I try to put up some educational stuff and hopefully people can find it helpful. And then, as alluded to, I've got a YouTube channel, a little more long form content called Cut to the Bone that is starting to blend more lifestyle stuff with orthopedic surgery. And there's also a combat sports tint to it, as that is an important part of my life.
Awesome. Well, thanks again. Thanks, everyone. And we will see you next time on the Medical Fitness Podcast.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.